Welcome back to the PFC podcast. The views and opinions you are about to hear are the speakers and do not necessarily reflect those of anyone else. Now on to the podcast.
Welcome back to the PFC podcast. This is Dennis, and today I'm with Max. How are you doing today?
Good, sir. Thank you for having me on. It's an honor to be here. Thank you so much.
Oh, the honor is definitely mine. Since this is the first time on our podcast, would you mind just doing a real quick introduction to yourself?
Absolutely. I'm Max Sirkin. I'm a trauma surgeon with the U.S. Army, Lieutenant Colonel. And I did my medical school at Medical College of Virginia, my undergrad at University of Richmond in Richmond, Virginia. And I did my trauma critical care fellowship at UNC. I joined the Army in 2007. Did my surgical residency in El Paso, Texas. And I've been on 6 combat deployments, in my time, 2 to Afghanistan, 2 to Iraq, and 2 to Africa. And it's just an honor to be here and talk to you.
I really appreciate it. And, today, what I'd like to talk about is a topic you covered at, SOMSA 24. And I thought it was a really fascinating, story. And I'd like to get into, this MASCAS and your aspects of it, and maybe have some other tips and tricks along the way. So if you wouldn't mind just starting off with kind of the events as they happened, and we'll stop at once you get to evac.
Yeah, absolutely. One of the things about me that I think people should know going into this, because it's important, is a lot of us as medical providers are used to being on the treatment end. Prior to this event, I've been on the treatment end of, I want to say, 8 or 9 MASCALs in combat. A couple of them during rocket attacks under fire. I think the largest MASCAL I had was my last one in Afghanistan, actually right before HKIA. That was 29 patients. And then I had a couple in the 20s, and then most of them were around 4 to 8 patients prior to that. And so going into a MASCAL, you understand the chaos that surrounds that environment, the physical and mental trauma that is surrounding that event, the gore, and the need to make quick and effective decision making. On this last trip, what we're going to talk about is being a patient in a MASCAL. And as I was one of 22 patients in a MASCAL, it was an incredibly eye-opening experience that we're going to talk about. And it let me know a lot of the things that I wish I had done better. A lot of things that I was doing well, and that are important. But it's an amazing experience that I hope no one else goes through. So hopefully I can give you that information and you won't have to learn the hard way. So, but yeah, like I said, I won't talk about, who I was with. It's not important or anything like that. But we'll just talk about kind of the details, and so, we were in the, CENTCOM AO, and going to do something. And my team, it includes, it's me as the trauma surgeon or a surgeon, and, my radio operator, my ER doctor, my team leader is a PA, and then my, CRNA. We were 5 of 22 people on that CH-47 going to target. And the other people on the plane are other mission essential people for the thing. We had 4 crew chiefs, and I think we had 3 pilots that night. One was sitting jump seat. And we were going out somewhere that was really far away. And so in order to get there, we have to land at a forward refueling plate, forward aerial refueling pit, FARP. Unbeknownst to us, this FARP is so far out there, they get their fuel airdropped to them. what they were doing potentially was not, I don't know, but like it sounds like that the parachutes that they were getting were not being secured correctly, and potentially came up into our rotor system. And so, but we didn't know that at the time. I'm just sitting in the helicopter, and the way that I'm usually oriented is that if you're looking at a 47, it's the twin rotor helicopter for people that may not know. And so you have the pilots in the cockpit in front. Behind that are the two miniguns, and then behind the front right minigun is me. And I'm usually laying down right next to our surgical table in kind of a beach chair position with my feet facing towards the ramp. The rest of my team is around me, and then everyone else is on the back part. And we're just coming into land. This is supposed to be no stress, the easy part of the night, just stopping at the gas station, right? And so right away, though, I knew something was not right. It's like, when you pull into your driveway 100 times, you know what it feels like, all that stuff. And then all of a sudden you run over the neighbor's cat and you're like, something didn't feel right. It was like that. And we're coming in, and I had felt something I've never felt before. The back half of the helicopter started oscillating, separately. Usually there's all kinds of twisting and turning and vibrations. That's part of the game, but this was something I'd never felt before, never seen before. And I mean, it was immediately jarring. And, time dilation is a real thing, because this whole thing took probably seconds, but to me it felt like minutes. Because I remember seeing the back half of the helicopter twisting, and I remember thinking to myself, that's not supposed to happen. This is really not good. I don't know much about these aircrafts, but I don't think they're meant to twist like that. And then I remember saying to myself, I was like, there's no way we're about to be in a helicopter crash. It's like, that's not really a thing, right? And I'm about to key into my mic to relay my sarcastic concerns and thoughts to my anesthesia buddy behind me. And as I go to do that, there's just this explosion. There's these sparks in the top of the cabin, this metallic scream and ripping noise, and then an explosion. And in the split second after this like fireball in the cabin, I see between my legs, I go immediately into like this kind of fetal position with my knees tucked in. I'm like, oh shit. And I'm looking through my feet, and I see this scene that you're not supposed to see, that's burned into my retinas. And I see that basically the back half of the helicopter, where the two 240s are in the back, and the ramp is just gone. It's gone. It's night sky, and we're in 0G. Things are floating, and we're falling. And there's no back half of the helicopter, and we're falling. And I remember thinking to myself, like, oh, this is what you see before you die. I'm going to die. Like, there's no way you can't, like, see, the jaws of a great white shark around your head about to come down on you and be like, I can't wait to talk about this on a podcast later. Like, that's not a thing, So I was like, okay, an immense, insane amount of fear, and we fell, and I was just like tensed up, getting ready to feel what it feels like to die. And we slammed down hard. The aircraft listed to its left, my right, and slammed down, I think, on my surgical table. And just, that was most of my injury pattern, was just crushing down on that, because my right side plate, I found out later, was just gone. My right kit, everything on my right side was gone, and that's where my injuries were. So wherever you are, right side plate, thank you for saving my life. Then we slammed back to the left against the skin of the aircraft. I did. And then slammed back to the right one last time. And I got yorked by my monkey tail as I did that. And I remember as I got flung across the last time and yanked back like a yo-yo, I remember hearing and seeing and feeling just the chopping of the rotor system. And saw it cut through the cabin like 2 feet from my head. And I actually thought I had made that up, because it was just, there was so much noise and chaos, and your brain is just going to new levels that you never thought were possible. Then your eyes are intermittently closed because you're terrified and you're hearing all these noises. But I'd actually seen the video and pictures of the crash, a couple days later, and sure as shit, there's a cut right through the cabin, right where I was, or across from where I was, right where I thought, and the rotor blade from the back half of the system just sitting there. Because what had happened was, as the helicopter twisted and broke in half, the rear system hit the ground and then chopped back through. So I'd also like to thank my monkey tail for preventing me from going into the blender. It's just unreal how all that came together. It's unreal to think about how any of the 22 of us are alive, let alone all of us. It's something I just think about, like, how did that happen constantly? How did that happen, and how are we all still alive? Sorry for the aside, but it's just something that continuously is in my mind. The electrical whining dies down, and now there's just like kind of twisting metal and fire noise, and my ears are kind of shut. My head is ringing, and I open my eyes, and it's dark, but I can see because everything's illuminated by the fires. And I'm laying across the aircraft, perpendicular to the aircraft. My feet are up on the right side, right skin of the aircraft, and I'm laying across perpendicular. And I'm like, I wake up and I'm like, okay, well, I'm alive. And the first thing I see is, like, because I had broken my femur about a year beforehand during a jump. And I realized, like, one of the things when I couldn't get up was that because my right leg was like this. And so, I did, like, almost didn't want to open my eyes. And I did. And I look at my 2 legs, and both of my feet are pointed in the right direction. I could wiggle them, and I could bend my knees. I was like, okay, thank God. That's step 1. That's huge. And I do like a quick, like, okay, let's do this. And so I pull myself up by my monkey tail, and I undo my monkey tail, and now I'm standing there just kind of like, what the fuck? And everything's on fire. Everything's soaking wet. Like, I'd never realized this, but like, there's fire outside the aircraft. It's hot because things are like kind of, that post-explosion just kind of twisted, just, I don't know how to describe it, but like that aluminum gets like almost like an oven baked kind of sense to it after it's been in an explosion or been near fire. And like, but it's everything's got that kind of post-bake musk. Things are still on fire. You feel like you're drunk and deaf at the same time. And, everything is wet. I didn't expect that, but like all the unburned JP8, the transmission fluid, blood, I didn't expect things to be that wet. And I only realized that because I kind of stood up, and all the ballistic plates are cockeyed because they've been shuffled around the whole aircraft. And there's a crew chief out the back of what used to be the ramp area of the helicopter. Now it's just twisted metal and wires and fire. And he's like, get the fuck out now. Like, get out. Everything's on fire. And I remember thinking to him, like, oh yeah, like that's what I'm supposed to do, you know? Like, but then I was like, yeah, no shit, dude. Like, yeah, obviously I'm going to go out of the helicopter. Like, I thought I was just going to sit back down and reflect on things and have a cigarette. Like, and so this is where it gets crazy, because like I went to run to get out of the aircraft, and a combination of the plates being cockeyed, me being, you know, battle drunk or whatever you want to call it, shocked, and my left hamstring being torn, and everything being wet, I immediately went to just like fucking run out and fell right on my face. I could not, and I was like, and it was like you watch movies, these horror movies, and people are running through the forest and they fall, and you're like, how the fuck can that happen? And it's like, it was like, I tried to get out, and I fell on my ass. I got up again. I tried to run out. I fell on my ass again. And it was like, I can't get the fuck out of here. I know where I need to go. I need to get out, but I can't. It was like a nightmare. So finally I was like, well, fuck it, dude. So I just start crawling out, and, just hand over hand, the metal is fucking hot, and I'm crawling in, and I'm seeing like rocket pods next to me, boxes of 7.62 ammo belts. And I'm just like, motherfucker, like, please let me get out of here before this explodes. Like, just like arm over arm. And the crew chief is standing beyond the twisted metal that's still kind of smoldering. And he's like, come on, man, you can do it. You're almost there. You're almost there. And I'm just like crawling. And I'm like, please don't explode. God damn it. Just let me get out of here. Please. I get free, and I'm on the gravel. And then once I get on the gravel, he kind of helps me get like a little bit away. And then I crawl some more to the retaining wall. And I don't know if anyone's ever been on ground in a FARP. That was the first time I've ever been on the ground in a FARP. But they are these giant 2-story HESCO barrier walls all the way around with a big iron rock gate. And the reason is because if there's an explosion, they don't want it spreading to the other gas tanks, right? The other fueling pits. But it also makes for a pretty terrible environment for a mass cow, because it turns it into a fucking oven that you cannot escape from. And so I crawl to the retaining wall, and I'm just like on hands and knees, and I'm just like, I'm catching my breath, and there's other guys that make it to the wall, and we're all there. It's not all of us, but I can see it, like 3 or 4 guys to my right, 3 or 4 guys to my left. And I'm just like, we're all doing the same thing. We're all facing the wall, bent over, breathing deep, kind of just looking at the ground, looking at each other, and like, what the fuck just happened? And I shed my kit. It's just destroyed. It's just covered in blood. My right side plate's gone. It's tattered to shreds. I rip it off. I use the wall to kind of stand up erect. And I do like kind of an assessment, and I'm like, okay, all right, I can think. That's good. I can stand. That's good. My hands, they got blood on them, but I can use them. And something's wrong with my left leg. But if I lock it out, I can function. I can make steps if I lock it out. And then I was like, something in my chest is wrong, but right now I can breathe. I can pace myself and do something. So then I look back to the helicopter, and, which is only like fucking 15 feet away. It's not far, which again, kind of speaks to the horror of the situation, in the sense that like you want to get away from that, but you can't. You're stuck in the burning oven with this thing and everyone else, and it's still on fire. And I look back and I'm like, okay, I can still do something. And I see these 2 silhouettes, 2 people struggling to get a third person out, but I can't really make it out because it's like past all of the sparks and like, twisted metal kind of, of what was the back half of the helicopter. So I stumble over there, and I go into and I grab the guy's, shoulder straps that they're trying to get out. And I help them pull them. I just pull as hard as I can, past what was the back half of the helicopter, all that twisted, singed metal, pull him out, get him to the gravel, and then I just like, and that was it. I was like, I did that, as hard as I could, just pulled him out, got him to the ground. The other 2 kept dragging him, and then I stood up, and I was like, I can't fucking breathe. It was like, it's not the wind's been knocked out of me. Like something is wrong. I've never felt this way before. I'm trying to breathe and I can't breathe. To the point where like I started graying out and I couldn't stand anymore. So I go back to the ground and now I'm back on all fours. I'm in like kind of like just hands and knees position because that felt better to me. And that was the only way I could ambulate, was just on my hands and knees, because standing up, I was going to pass out if I stood up, even if I physically could. But like being in that position somehow allowed me to somewhat breathe and move. And so I just kept crawling on my hands and knees away from the helicopter. But again, like there's nowhere to fucking go. It's a pit of hell. You know, like, there's the gate that's locked. Some dudes were trying to open the gate. But like we're all just crawling away from something we can't get away from. And I'm crawling and I hear, my CRNA, who is from South Carolina. He has an indistinguishable voice. He looks like Charlie Daniels. He's such a good dude. And he's got a very indistinguishable voice. And he's screaming for our team leader. And he comes stumbling around. And I hear him. I know who it is. But I can only see his legs because I'm on my hands and knees. And I grab his legs as he's walking past me. And I say his name. And he looks down at me. He's like, "Is that you?" I was like, "Yeah, man." He's like, "I think if I sit down, I'm not gonna be able to get back up." And I was like, "Hey, I can't breathe, man. Something's wrong. Like, I can't breathe and I think I'm gonna die." And so he sits down and that's the first time I actually get to look at him. He's got blood all over his face. He's got blood in his eyes, all over his face. He can't see. And he's like, "Max, I can't see and I can't get back up. Something's wrong with my legs." And I'm like, "Hey, I can't breathe, man." And so he's like, "Just sit here. You'll be okay." And he turned me to my back, and it was, I don't know how to describe it, but like he was kind of sitting down and I was kind of like next to him, kind of like between his legs, and I was sitting up on him with my knees bent, and he was kind of propping me up, and that was the only way that I was able to breathe. And this is the part that was just like, I mean, if you want to talk about things that I don't really want to talk about, but should and have to, is like this next part. I try not to think about it too much. But in all fairness, and part of like my, rehab, you have that exercise that you don't want to do because it hurts when you do it, but it's really good for you. That's the same thing with mental rehab is, that was the first time I like had a second to really assess what was happening, like from a distance, really clearly see and hear. Okay, because up until this point, it was just like fucking survive, move, go to point A, go to point B, go to point C, survive for the next step, the next arm, the next, and this was like the first second that I had, not really to process everything, but it was the first second I had to see and hear the scene. And I'm sitting there, and I just I see bodies everywhere. I mean, there's dudes that are laying on the ground, they're not moving, and other guys are running over to help them, and they're like, "What do I do? He's not moving. We need help." Yelling for medic. There's bodies over there that aren't moving, that don't have anyone near them. There's dudes dragging people around. Everyone's yelling for help, yelling for medic. And I can't help them. I can't help them, and I can't even help myself. And, like it's so fucking awful. I'm the guy that's supposed to be there to help those dudes. I've been in those positions where I've shown up and been the guy to triage and help and definitively manage. And now I can't even help myself, which I'm okay with, right? Like, if I'm the guy fucking hurt, he's about to die, like, that sucks, but I'm okay with that. But now I'm hurt. I can't even help myself. I feel like I'm going to die. And now the last thing I'm going to see on this earth is all the people I let down. All my brothers I let down you got dudes who are non-medical, that are panicking, that are watching their buddy, like, not move and trying to figure out what to do. And I am the only reason I'm there and have chosen this life is to be the person to help that guy. But I can't. And now I've just got to watch it happen. I've got to watch this chaos happen. That I'm the only person, even on my team. I was the only person, with the exception of my team leader, that has been in a situation like that. And from a medical standpoint, and it was the worst feeling in the world. It was the worst feeling in the world. There was a part of me that did not believe it was real, because I was like, there is no fucking way that this is how it ends. Like, what a Twilight Zone horror bullshit ending of, like, I'm gonna die and I can't help any of the people that I'm here to help. And I have to watch. This is the last thing I'm going to see. It was off. Shafrina came running over. He also spoke at SOMSA. He was my ER doc. A buddy of mine I've known since before, since basic training. I mean, you want to talk about small world. My ER doc on my team was a buddy of mine since 2008. I've known him longer than I've known my wife. And he came running over and he ripped my shirt open. And I just saw this cut going from my, like, left ASIS all the way up my right side. It was this big cut, bruise, seatbelt sign, road rash. And my abdomen was in so much pain. My chest wall was in so much pain. I couldn't breathe. And he's like, he says, like, we need to put a needle D in you. And I was like, anyway, there was talk of a needle D real quick. And we both agreed, like, that's not what we should do. Because I'm able to breathe as long as I'm sitting up and my knees are bent, I'm able to breathe. And there are other people that he needs to be taken care of. And so he ran back to the helicopter to get medical supplies and blood, and then started providing aid. And I just remember thinking to myself,
I have a real quick question. So I'm really sorry to interrupt you.
Well, no.
But when you say, like, I can't breathe, did it hurt to breathe, or you just couldn't physically get the air in?
Both. So my injuries, this is a good time, I guess, to talk about my injury pattern. I had broken 10 ribs, front and back. So basically, because my chest plate was there, when instead of the thing impacting and breaking and going into my chest wall, whatever I hit and going in, the chest plate distributed that stress to all the connection points. So instead of my chest kind of caving in like this, my right chest wall just went like this, right? So all of my fractures were from my first rib all the way down through my cartilage on the front side, and then along my spine on the back side. So my entire, like, right chest wall was, like, almost all of it was one massive flail segment with a pulmonary contusion, with a hemothorax, with a liver lac. And then I also had a torn left hamstring, a fractured left molar, and a fractured jaw. And then obviously TBI and all that. So those are my injuries. So it hurt to breathe, but it also, I could not catch my breath. That was the thing, is I could not get a full breath. And that's an incredibly, I mean, I know what it feels like now. You know, people tell you that, but you don't really know what it feels like. But to like try to take a deep breath and you can't, and your inspiratory capacity is like half of what you think it is or want it to be. It was like being kind of slowly choked out, because like if I didn't move and had my knees up and Glenn was sitting me up and focused everything on my being, I could take these slow little guppy breaths and focus on staving off the blackout. Like I was in like a perpetual like state of almost gray out. But if I could like focus on breathing, then I could maintain, right? And it hurt to do that big time. But any exertion, like any trying to stand up or exert myself, and the gray got more, you know, like that oxygen starving got more, right? Does that make sense?
Yep.
Yeah,
Absolutely.
yeah. And so now I'm sitting there with Glenn, and I'm looking around, and with the pattern I see and how I feel, I know that I've got something internal abdomen trauma. Something is not right in my right chest, and it's getting worse. I don't know where we are exactly, but I know that there's no other surgeons there, and eventually I'm going to need an operating room and an OR and a surgeon and blood, and that's just for me. And I'm looking at dudes who are way worse than me, and I can't help them. And I'm just thinking to myself, like, this is hopeless. This is beyond hopeless. There's nothing. I had this complete loss of faith, just like in acceptance. But Glenn was with me, and my CRNA, and I knew that I wasn't. I was like, I'm gonna die. There's no way that someone can just magically show up and unfuck this situation. I'm gonna die, but at least I'm not alone, you know. And I got a good buddy of mine here, and that brought me a lot of relief, you know. Seeing Shafrena, seeing a guy I've known my whole life come and take care of me, and then actually move into the crowd and start saving other lives. And that was huge. Like I was okay. I wasn't happy about dying, but I was okay with it, and it brought me peace. I knew that, like, even though I failed at my ultimate task, I wasn't going to be alone, you know. And that was good. That brought me peace. And that's something that people don't talk about is, you know, I called it in my SOMSA talk, 10 cc's of a friendly face, right? Let's having a brother there. It's not anything I was ever taught in medical school. But it is so important. Even if you can't do anything, you just need to be there for your guy, for your brother. Just being there is so important. The physiologic relief that gives, the mental relief, the mental and the spiritual peace that provides. It costs nothing. And it is so valuable. Just being there with someone that you know, that you, at least that peace of mind that you're not going to die alone, right? Is so important. And again, speaking to my ignorance as a medical guy, a non-operator, you know, soldiers have been doing that since the beginning of time. They know the importance subconsciously, right? Because it's their brother, it's their family member, it's my brother, you know, like you're just there. You do it instinctively, but it's so important. And I say this because, one, I want to reinforce how important it is, and two, to not discredit it. Like, even if you have no medical training, just fucking be there. Be there for the guy. That is so huge. It's something that is often in the medical world discounted and discredited. And I want to speak to my other medical physician colleagues and say that's something that you should do. Like, you should just do, even if you're in a MASCAL or in a hospital and you can't do anything as a doctor. That's not the time to walk away and go do other stuff. That's the time to be there for your soldier or their dependent or the veteran, right? That's an important point. Anyways, I digress. I apologize. So, we're outside this wreck. I'm with Glenn. We can't get away. We're stuck in this pit of hell. It's a burning furnace. I'm just waiting for more explosions to happen. And all hope is lost. I have given up any faith of me seeing the next day. And then all of a sudden, like a goddamn scene out of a movie, dude, these white lights just start climbing over the HESCO walls. And people start breaching the gates. And it was all of the other people that we were with and the other helicopters just start running in as a giant crowd, putting out the fires and pulling us all out of the pit. And, I mean, it's unreal. It was unreal. You want to talk about heroes? Those guys that I work for are heroes. I mean, they climbed into that. I mean, you want to tell, there's a difference, I think in heroism of like going into combat versus another human being for an ideology or a mission, and then going into a unrelenting force of nature, with almost guaranteed injury to yourself, right? Like the difference between a cop and a fireman, right? They weren't cops that night. They were firemen. You know, it was a burning pit with lots more stuff that's going to explode. And without hesitation, those guys climbed over the walls into the fucking furnace that we were all trying to get out, to pull us out. And it was unreal. Those guys, and they do that every day. And it is an honor to just be in the same realm as them. And they saved all of our lives. They pulled us out. They pulled us out to the gravel outside, started the triage. They had their medic with them, who was augmented by a couple other medics from other organizations, and also Andrew, my ER doc. And then the roll 2, I didn't know was right there, came running up the hill in honestly their gym clothes and like, you know, Hiluxes and flatbed trucks. And then the MASCAL actually started, now that we were outside of the furnace and away from the physical danger. I remember, their surgeon was brought immediately to me. People were guiding him to me, because I was hurt so bad. And so he shows up and he's got like the army PT clothes on, and he looks at me, he's like, and he sees this dude with like a beard and like, you know, who looks, I don't want to say I look like those guys, but looks kind of like them. And he's like, and he could tell like, and I'm messed up, and he comes over and you can tell he's like, I was told you're the surgeon, and I was like, yeah. He's like, he's like, I'm the surgeon from the roll 2. He's like, who are you? I was like, I'm fucked up. And he's like, yeah, I can see that, buddy. He's like, this guy's number 1. And he puts me on a flatbed truck, and then they just start piling the bodies on the flatbed truck, and they roll us down the hill to the roll 2, and they bring me to the trauma bay. They're cutting off all my clothes. I'm now naked on the trauma bay. Alex Merkel, one of the heads of SOMSA, was one of the guys cutting off my clothes. I mean, you want to talk about a small world. But yeah, it's, I'm in the trauma bay. They're cutting off my clothes. They're starting IVs. They're giving me meds and all this stuff. And they start bringing in guys next to me. And again, just another reminder of the, of my failure, is they start bringing in, some of the crew chiefs and some of the other guys next to me. And, they're getting blood and like, they got chest tubes in, pelvic binders, exposed fractures, and they're not moving. I'm at least able to move and communicate, albeit like, difficultly. It really sucked to not be able to help them and to then be down for the count yourself. Like the injuries to myself, I can take that, but to just not be there for your guys and to see, one of the guys they brought next to me was my RTO who had an open fracture and needed a lot of blood, open femur fracture and needed a lot of blood. And he was pretty messed up. And then one of the crew chiefs they brought in next to him was unresponsive, had a pelvis full of blood, open fractures, chest tubes, getting intubated. And I just I looked at all these guys and I just kept wanting to get up and help them, but I could not physically even breathe. And it was just like being shown that, like, just kind of like sticking your head in your failure. Is hard. I think about it all the time. It sucks.
I mean, not to interrupt you again, but you keep mentioning like your failure.
Yeah.
Why?
It feels that way. It feels that way, that's the reality. Is there anything I did that made me, that affected that outcome? No, I know that to be true. I know that it was not, there's nothing I did that made it to where I couldn't perform, right? It's just something that happened. But I will be honest with you, no matter what I do or say, and going into the behavioral health realm of things, and all the stuff I've been doing to get better at that, and process this and move on, and the positive things that have come from this, I would be lying if I said that it still feels like a failure. I mean, I know I can rationalize that there's nothing wrong I did. I did my best. Shit, I pulled someone out. At least I pulled myself out so no one had to risk their life to come get me, right? But, and I've learned so much from this event that has affected positive change. But this is who I am. I'm a trauma surgeon. I'm trained, and my pathway as a trauma surgeon is to be the guy in mass cows to save lives. And that night I wasn't. And I know that there was nothing I could have done differently. But for the rest of my life, the hardest thing about that night is that it will always feel like a failure. Always. Even though I know that it wasn't, and there's nothing that I could have done differently. You can't, gut your way through the injuries I had and do surgery, right? So it's just like, maybe you could, maybe there's a surgeon out there who can operate with a flail chest and a hemothorax and a liver lac, maybe, I don't know. But
I really doubt it.
I could, And so, but I would be honest with this thing, the thing that is the hardest is like, it will always feel like a failure. And that's something that I continuously deal with. And so, but you're right. I know it wasn't, but it's hard to look at your brothers who are needing surgical help and expertise and are dying, and you can't do anything about it. Yeah,
I definitely understand that the feeling.
Yeah.
But it's just something that kept pinging in my mind is like, there's a reason why you were number one.
Yeah. Yeah. Yeah.
And it wasn't because rank, and it wasn't because job description. You needed the help right now.
Yeah.
And so, I think just being able to put things in perspective, which obviously you have, but like I just pinged in my mind, like he keeps blaming himself for something that was absolutely impossible. Like, had you said I broke my wrist and I just laid there and watched all these things happen, and I'd be like, yeah, pussy, get up. But
yeah,
that is not the case at all.
Well, thank you. I appreciate that. That means a lot. It does, especially coming from you. So thank you very much. Yeah, it's, there are many things. Well, I think what I want to talk about the most is the behavioral health aspect, but also some of the lessons learned, from an actual, medical standpoint, MassCal standpoint. And, let's remember this for that discussion, is, the scars, right? The scars, and I would say the first injuries, the insults, right? The first thing is just the fear of trauma and death. That's the most basic and brute in your face. Seeing me fall, or seeing us fall in the back half of the helicopter. That's a terrifying image, that had effects. And the feeling of just being inadequate, from the event itself, and failing and letting your brothers down. That's a whole other moral injury that has to be treated separately, right? Like a broken rib is treated separate than a broken jaw, and the broken jaw actually was discovered a year later. I kept having neck pain, and they discovered that they did a CT narrow cone, and they were like, hey, did you ever have trauma to your face? I was like, yeah, I did. They're like, yeah, you have a jaw fracture at the base of this fractured molar. I was like, I think I know how that happened. So it's like, but that is treated different than this, right? There's multiple flavors of emotional trauma, right? The fear of the getting in a helicopter again and having it fall out of the sky. The fear of being an inadequate surgeon again and not letting down your brothers. 2 insults, 2 different treatment pathways, both under the auspice of behavioral health trauma, right? So it's something to think about, because we'll go into that, my road to recovery from a behavioral health standpoint. But so I'm in the trauma bay, and they do a fast. The fast initially there was negative, but they realized that if they gave me pain and they again set me up, that I could, and they let me bend my knees on the stretcher, that I could maintain my airway. And so they were like, they were going back and forth like for chest tubes, and then like ultimately, it's funny. One of the things we'll talk about is less is more, right? Is like, that's one of the points I brought up at Soma. Less intervention can sometimes be more. Their hand was kind of forced by the situation, because you could tell. I do remember vaguely them having disagreement about putting chest tubes in me and getting me to the OR for an exploration. But then there was like another guy who was like, yeah, but his fast is negative. But someone was like, yeah, but look at this. See, like, there's no way that it's, and so and they were going back and forth. And then finally more patients kept coming in. And so they made the decision. They were like, well, fuck it. Just put him behind anesthesia on a stretcher, and we'll just keep checking on him. And if he gets worse, we'll just take him to the OR and put chest tubes in him and do stuff. And so that was a brilliant decision by them, because again, like they had every right to put chest tubes in me, to take me to the OR. But now in hindsight that I know that I made it through all of this as the can that got kicked down the road without surgery, without chest tubes, like, and I did okay. Maybe they were right to do that, but they got to the right solution because the situation forced them to. And that's something that I could see as the patient who has experience in a mass cowl. Like that might actually be the right answer, right? And lo and behold, it's something that the Israelis and the Norwegians and the Ukrainians have been discovering through war, right? Like, hey, if the dude can talk and breathe on his own, even though you think he's messed up, let him do those things. Because one, you taking it away could actually kill him, because he's probably emitting every stress response possible and sympathetic tone possible to maintain that level. And if you put a tube in me or take my airway, the bottom comes out. So now you got a dude who's a professional athlete riding that line, and then you take the bottom out. Now you got a dude who's got no pulse, right? And so, or you waste a lot of time and resources on a dude who might not need it, doesn't need it, and you burn it for the guys that do need it, right? And so, because I'll tell you, there were 3 individuals that night that did need airways, and they got them. And there were no more airways, right? Actually, one of them got them at Baghdad. 2 individuals needed airways, and we only had 2 vents, right? And so if they had given me one of the vents or wasted time with a chest tube for me, then maybe one of those guys would not be alive right now. And that's a decision I would not be happy with or live with, right? And so,
from your, I don't know if you got to see your documentation from the roll 2. Do you know what kind of vitals you had?
I do not remember. The person who would know that would be Andrew Shafrina. I think my sats were in the low 90s on oxygen, and I was tachycardic with a stable blood pressure. But again, in that case, then that decision makes absolute sense. Yes. Yes, it does, right? It does. And so, but again, like there are people that don't understand as well as you and I that, like, you know, young, healthy men and women don't have zone 3, hemorrhagic shock. They have tachycardia, and sustained blood pressure, and then unconscious, right? Because the sympathetic tone is so great that they are able to squeeze every last blood vessel until there's no more drops of blood, and then the bottom comes out, right? And that's what we're learning, is that we get all these guys who have these horrible injury patterns that have a normal blood pressure, but they've got penetrating chest injury or obvious blunt chest trauma or multiple amputations or whatever. And their blood pressure is okay. They are tachycardic, or their blood pressure is like sitting around 90, like permissive hypotension. They're tachycardic. And then someone's like, okay, let's get an airway in them. Let's put chest tubes in them, and then we'll give them blood. Wrong. You're going to turn that dude who's barely alive into a dead person, right? Because you're going to take away all their sympathetic tone. You're going to put more burden on them to breathe. It took every ounce of concentration and physical might to take the next breath for me, but I could do it. If you gave me pain medication, sat me up, put my knees up, I could protect my own airway. And if anyone had put a chest tube in me, I know that I could take no more pain. You put a chest tube in me, I was going to stop breathing, and you were going to have to tube me. And you were going to have to tube me. Potentially the floor would have come out, or you would have just burned valuable equipment on a dude who didn't need it, right? And so if you're going to put a tube in someone, put it in their IV and give them blood. and then let them sit somewhere and protect their own airway. The Roll 2 did that. I don't know if they did it. Actually, they didn't do it on purpose, I think. I'm pretty sure they did, because they were consternating about a lot of it, and then more patients came in, but they made the right decision. Does that make sense? And so, like, they made the right decision because the force of nature just forced their hand, right? It ended up being the right decision.
Right.
And so
I think the beauty of what they did, we had a guy he was doing okay. Like, we have chaos, like, swirling around behind me. Like, he's okay right now. However, if that okay starts to go south, like, we automatically have a plan.
Yes.
And we'll jump that bridge when we get to it, if we get to it. But for the moment, we're just going to let that rock perch right there, and we're going to continue sorting out what's going on behind us. Yeah. I think that in itself, I think, is the right answer, because they knew exactly where you were, and they had, even if it wasn't like a definitive written down plan, it was like, if it gets less than fill in the blank, then we're going to do it, you know? Does that make sense?
Absolutely. Like, absolutely makes sense. Yeah. Yeah. And
versus like somebody that was like, he looks all right. Like, just stick him in a corner and then move on. Less is more, you know?
No. It's one of those things. It's like the apple hitting Newton in the head, right? It happened, but it's your job to look at it and learn from it and ask, like, okay, why did it happen? And also, like, what's important about this? Like, they made 100% the right call because they were trained in that situation, and they knew that, like you said, this guy's sick. He has potential for major problems, but he's okay right now. We just got 5 more fucking dudes with 5 more on the way behind them and 5 more on the way behind them coming in. We don't know what the injury pattern is, like tissue on the table versus tissue en route, right? That's something we always talk about as surgeons. Like, is it the guy on the table, or if you have troops in contact, is it the dudes that might be coming in? That is the perpetual argument and battle that you need to be having with yourself as the person in a mass cow. That is something that I've had. We can, if you want, we can talk about other mass cows in another talk, but that is the decision, right? Do you spend everything you have right now on guy number 1, or do you wait and see, right? It's an impossible question, but there are ways to mitigate that, and that team at the Roll 2 did it perfectly. They literally took my stretcher off the trauma bay and put it right there behind them, and kept taking the next guys. And I had the wonderful pleasure of being able to see all of my brothers coming into the next trauma bay. I got a front row seat, which was fucking awful. But I was right next to them, and they were continuously, like, they'd bring in a trauma patient, and every time they had a second to take a breath, they'd come back and assess me and go back. And it was great. It was, and if you are ever training for mass cows, or in a mass cow, you know, that sometimes less is more. If you have more patients coming in the door and the guy doesn't need anything right then and there, then keep him close by and figure out what else you have, because you don't want to burn resources that you might need, or turn a stable non-problem with 10 other potential problems into a real fucking problem, right? And that math is very hard. And takes time and experience. Yeah.
Yeah. I mean, it reminds me, Doug Powell says it all the time, from Voltaire, the enemy of good is perfect. And so at that moment, you were good. I think medically they had every right to try to make you perfect. But in that situation, like, it makes no sense. Like, you're not really gaining any ground, and potentially could lose somebody or multiple people.
Yeah.
Doing stuff for the sake of the algorithm.
Yeah, absolutely. Absolutely. 100% correct. And so yeah, I guess the first of the points I wanted to talk about, which is less is more, is exactly that, right? You need to, we've said it, the enemy of good is better. And if a guy is protecting himself and doing okay, keep him close, but move on, right? And don't take someone's airway or or don't take someone's airway or put a needle in their chest or a tube in their chest, without giving them blood. Like, that's the bottom line. In our world, now in a hospital, it's different. I'm not talking to the guys at shock who see all kinds of stuff, but in our world, in the deployed setting, in the dirt, where the injury pattern is hemorrhage, in a young, active athlete, right? I was talking with Dave Harden. I think we can both count on one hand the amount of times we've seen someone actually succumb to a true tension pneumothorax. And probably on two hands, the times we've seen someone succumb to an airway emergency that didn't get an intervention, right? And so, like, and again, if the dude's unconscious and not breathing, well, in a mass cal scenario, most of the algorithms would tell you to move on, right? But if the dude's unconscious and breathing, then yeah, you do what you got to do. You have someone breathe for him, and you put the tubes in the chest. But, like, for the dude who's breathing, who's awake and with it, right? Barring a few exceptions that I can think of like direct trauma to the airway, which has happened, but again, very rare and very obvious too. Like isolated trauma to, like, right here, like, okay, yeah, that's obvious, dude. Like, yeah, get an airway in that guy, right? But I mean, even the penetrating injuries to the chest and the blunt injuries to the chest, like, if there have been many times where, like, the dude has had blood in his mouth, blood in his airway, hemothorax, pneumothorax, you've got time to tripod that guy, to let him get in a position where he's going to protect himself while you get a tube in his arm and give him blood, right? And so, and I can speak from experience. Like, if they had laid me flat, I would not have been able to breathe. If they put a needle D in my chest, no. Yeah, a thoracostomy, no, right? Like, but they were not, because they were listening to me. I said, I need to fucking, like, sit me up, let me bend my knees. They had me strapped down with the litter straps, and I kept doing this, and they were like, oh, we need you to be calm. And I, like, grabbed the medic. I was like, dude, let me bend my knees. I can breathe. And he's like, okay. So I bent my knees and I sat up a little bit, and I could breathe. And I don't know why. I've been thinking about that. I'm not sure why. Because I always thought, like, it would increase my abdominal pressure, but for some reason, bending my knees, and sitting me up, that part I get, was just able to let me catch my fucking breath. I'm not sure. But it worked. And so, yeah, less is more. That's the bottom line there. So then, they give me ketamine, and this is the beginning of the end, right? I had actually had ketamine before once. I got it on the drop zone, when I broke my femur, St. Mare drop zone. And they gave me ketamine. They gave me IM ketamine, and then I had two 82nd Airborne medics hold my shoulders, while a third pulled my femur out to length on the DZ. Yeah. Oh, yeah. That was a good fucking time. So I'm no stranger to physical trauma. But yeah, going back about a year and a half before this crash, I broke my femur 4 places. It was shortened and twisted the opposite direction, and they couldn't get me on the stretcher because I was in too much pain. So they were like, well, okay, we need to reduce him on the DZ. So they gave me IM ketamine, let it kick in, and then they grabbed me and then just pulled my leg back out to length, and put me in traction, on the DZ. Easily the worst pain in my life. Yeah, for sure. And then I started tripping balls in the FLA on the way to the hospital, because the FLA, the way that they had their pain bags set up in the FLA was similar to how we have them set up in the 47. And I had a very vivid just hallucination that we were taking fire in this FLA, and that for some reason I was missing an eye. Like it was like this. I'd never hallucinated before. That the federal government knows about, and so that it was just like, it was a horrifying experience. It was a horrifying experience. Like I remember I get to the hospital, and Bob Diem, who's our PA at Womack, who was a prior team leader for my organization, was there who pulled me out of the FLA, and he kind of brought me out of it. I was like, oh my God, Bob, what's going on? He's like, dude, you're at the hospital, you're okay. But that was kind of my first experience with the hallucinogenic properties of ketamine, and it was not good. I did not enjoy it. So I get ketamine.
Do you remember how much they gave you?
Yeah, they gave me 50 of IM, which again, I guess I'm a lightweight, because like the doses I got, I did dose stack during this story. But like, yeah, I guess I'm lightweight, because 50 sent me into a pretty epic trip. That with the femur fracture. And
how much did you weigh?
I think at the time I was 170. Now about 185, 180. Yeah. And so, and during this story, I was probably 170 also. Yeah. And so,
Okay.
So in the trauma bay, they gave me 20 of IV ketamine, and immediately it took the pain away. I could breathe. I mean, it was immediate. I was like, oh my God. I still couldn't catch my breath, but I could breathe without the pain. And it was just easier to maintain. Right. And so they gave me the ketamine, and I go out. I get the pain relief, I'm breathing, and I go out. This hallucination was more just like kind of kaleidoscopic hallucination. Like it was just colors and shapes and I don't really know, but it was just like cool colors and shapes. And then all of a sudden, like I come out of it, and I'm under the rotors of a 60, and I'm half in, half out. And there's these two people screaming over top of me. I can't hear what they're saying because of the rotor wash. But there's a conventional like dust off medic leaning over my head, yelling at some dude dressed like you in flannels, yelling at her, and they are screaming at each other. And then finally he just like starts pulling the litter off, and then they agree to like pull the litter off, and then they put me on a bongo truck. And again, there's another thing too, is like, I didn't realize your situational awareness when you're a patient in these chaotic situations. Like, I don't know anything except what I could see right here, because I'm on a litter. I'm freezing cold. It's nighttime. And this is my entire situational awareness. People, Jen Gurney kept asking me like, how did it go? And I was like, if it wasn't here, I have no fucking idea, Jen. Like, I don't know. She's like, did you know that this and this was happening? And when we were running, like, and I was like, Jen, I was on ketamine, and this was my world. That's it. And then it's like again, something that I should have realized, right? And that we should realize as providers, but like you don't. And you don't realize how limited that scope of situational awareness is. Later, when we got to Baghdad, we had a PA with our organization who came by and went from person to person and was updating us. He was our liaison. He's a PA. And he was like, hey, how are you doing? What are your injury patterns? And that was so great because that was the first time that I got real situational awareness from a medically literate person on all of my buddies. And I could ask him how they were doing. And that was, again, talking about being there for someone. So fucking huge for me and for the other people too. Even if they're not medically literate, just knowing what's going on with your buddies, right? And so another thing too on that note, because I don't want to get off that topic just yet, is in Baghdad, they had us split up. A couple of us in the ICU, a couple of us in the floor tent, and a couple of us in the trauma bay. And me and Shifrina were like, this is bullshit. We have enough space in this ICU tent for everyone. Like, and so we spoke to the Role 2 commander and the nurses there, and we were like, put everyone in the same tent, please. And they were like, absolutely. And they put us all in the same tent. And again, just to be able to look to your left and look to your right and see your brothers, even though a couple of them are on the vent, they're there, right? That is so important. It's if you can do it as a provider in a mass count, once the dust settles, once the injuries are taken care of, or even, the chaos is somewhat controlled, get them together. That's so important. Again, something that probably shouldn't be said, but should be said, or shouldn't be said, but has to be said, right? I come out of it. I'm on the back of a bongo truck now. They take me from the 60 to a bongo truck. I have some medic who had I've never seen. He jumps on, and again, I don't know how long it's been. I'm naked under HPMK. I don't even know if I'm in the same fucking country. Was I landing on the helicopter, getting on that? I have no idea. And all of a sudden now there's a French dude talking to me, a French medic who's like yelling at me, and he's like asking me in broken English, like, what's wrong with you? And I'm like, I can't communicate this, dude. Like, I can barely fucking speak. I'm like, it hurts to breathe. That's all I said. He's like, I'm going to give you this. And he has like a big syringe that's empty. That's like a clear liquid with no label. He's like, it's like 60. It looks like a 2E syringe. And he's like, I'm going to give you this. I was like, oh, please don't. I was like, it hurts to breathe, but I can breathe. We're on a truck and you're the only person out here. Like, if this goes south, you might be the best medic in the world, but you're fucked, dude. Like, even I can see that there's nothing around, like we're on an airfield, I think, on a bongo truck at night, and you've got like a little fanny pack. That's not enough to unfuck the situation you could be creating right now, right? And I was like, oh, I started holding his hand. He's like, it's gonna be fine. I was like, no. And then like out of nowhere, a buddy of mine, Ranger medic, shows up. Real good friend of mine is Ian Wallentine. He was the medic of the year at Soma this last year when I spoke, and he was nominated for it. I don't think he was. I can't remember. He's a great fucking guy. He shows up and jumps on the back of the truck, and him and the other medics start like kind of talking and like getting into a little bit of professional discussion, medical professional discussion. And then finally, Ian's like, I got you, man. What's wrong? I was like, I can't breathe. And he's like, all right, I got ketamine for you. And he gives me another 20 of IV ketamine, and I go down again. And more kaleidoscopic vision, all this stuff. And then I wake up on a plane. I wake up on I now know it's a fixed wing aircraft, and I've got a fucking barrel of an M4 staring right at me. And I was like, oh, that's not good. And I'm laying down, and there's litters next to me, and there was an operator type dude with his weapon across his back, and the weapon was pointed down at me. So I grab it move it out of the way, and he doesn't like that. And then he realizes, oh, I'm a patient, and should probably he kind of realized what's going on. So, but coming out of that, again, I don't know where I am, when it is. I just know I'm in a plane and I'm staring at a rifle barrel, and so then Andrew's on that plane. Again, I see him. It brings me comfort. He comes running over. He gives me 20 or so more of IV ketamine. And I go out again. And I have a really bad trip. It wasn't bad. It was just weird. It was very clear visualization. I'm in a desert at nighttime. And it's, I don't know why, but it's a Native American Indian chief in like the full, unfortunately stereotypical clothing, headdress and everything. And then Johnny Cash in the desert at night, and there's a little fire pit and some 60s lawn chairs. And Johnny Cash is like, "Hey man, you're dead." And I was like, that sucks. But it was awesome. I don't want to say awesome. It was this like amazing relief. I don't have to worry about anything anymore. Like, he's like, "You're dead. It's okay. This isn't hell. We're just going to sit down and chill." And it was just like this wave. The pain was gone. The stress was gone. And I was just at peace. It was like, I don't have to worry about anything. That's other people's problem now. And we just sat there for what seemed like hours. Clear as day. I can close my eyes right now and picture it like it was something that actually happened. And then out of nowhere, I come out of it, and Andrew is like holding me up, holding my head up, and he has all the stuff ready for intubation and a chest tube. And he's like, "Dude, are you okay?" He's like, you were not doing well." And I grabbed him. I was like, "No more fucking ketamine, please." To the point where if you look at pictures, there's a couple pictures of me in Baghdad. It literally says "no ketamine" written on my shoulder. And so then, they just gave me Dilaudid and Versed, and that was enough to control my breathing and get me there. Then I got to Baghdad, and then, it became basically just your traditional Moscow drill at that point. I remember thinking to myself, I said this at Soma, and I think I want to say it here too, is like, I got to Baghdad. It was a flight of 10 of us at one time, and then another flight of 10. And we get there and land at Baghdad, and the doc triaging me fasts me, and my fast is positive, and I need more oxygen, and I'm not doing well. And I talked to the doc, and he's like, "Your fast is," he's like, "Hey, this fast is positive." And I asked him, I was like, "Hey, what kind of doctor are you?" And he's like, "I'm a family medicine doc." And I was like, I thought to myself, like, "Oh, okay, now I'm going to fucking die. Now I'm going to die." Like, there's no way that this family medicine doc is going to be able to stem the tide of this mass cow. And his name is Dr. Keene, Lieutenant Colonel Keene. And he did fucking great. And he deserves a lot of fucking credit, because that guy and his team nailed it. Because what were they doing at Baghdad on their bullshit sleepy deployment? They were running drills every fucking week, and they took it seriously, and it was obvious. Even from my little world on my stretcher, when I got to Baghdad, I could tell that they had been running the drills, and they knew the game, and they were all in the same picture. It was obvious to me, and they did a great job. And it's no secret. There's no magical, "Hey, here's on the podcast, I'm going to give my fucking secret," right? Like, the secret is training. I don't care how you do it. There are a million ways to run mass cows. You got to train, because the one thing that matters with a mass cow is getting everyone on the same page and being able to have a chain of communication and a plan when the chaos shows up. It doesn't matter what your drill is, what your battle drill is, what your algorithm is. Know it, train it, and be on the same page. Because when you have a framework, you can flex to fit the chaos, however that model is. But if you don't have a model and you have a bunch of cowboys that are just like, fuck it, we'll figure it out, that's a recipe for disaster. 100%. And it was so obvious when we got to Baghdad that those guys killed it. And then from there, it's really a story of recovery and behavioral health. I'll stop here if you want to touch on anything ahead of time. But otherwise, I was just going to talk about kind of the stuff afterwards and the behavioral health.
Sure.
Yeah.
I just really have one question. Because we were talking about training, and earlier, you mentioned you're sitting there like, this is the job I was made for, but I can't do it. There's chaos going on. People are yelling like, I don't know what to do. How important do you think it is to train non-medical people to do basic medical things?
Yeah, it's exceedingly important. We have been, I think the baseline of surgeons in general is, and I'm going to say this because I think everyone knows it, and no one likes to say it, but I'll say it. Surgeons have a reputation for being arrogant, for being holier, for being holier than thou, and putting themselves on pedestal. And I think part of that there is, I can see why, right? It's, you go to a lot of school, you get a lot of training, and you are by doctrine and by training the definitive answer, right? And I think that mentality can, in some people, create a mentality of, I am the bearer of my secrets. And if you are not willing to go to surgical residency and surgical training, or smart enough or tough enough, then I'm not going to teach you how to do it, because that is my practice. And how dare you think that you can just show up and get all the secrets of my practice? And that's bullshit. Total and utter bullshit. Because that is a mentality that, that might work at some fancy level 3 academic institution within the States. But the reality is when you step off the ground and you enter a combat zone, the bullets don't fucking care if you're a doctor. The missiles don't care if you're a doctor. The rockets don't care. The helicopter doesn't give a shit. And you may think that because you're a surgeon or a medical provider that you are protected because of your background, because you're too fucking special, because you have a halo of God and justice or whatever the fuck you want to call it. But you are no different than the dude right fucking next to you who might not even have a high school fucking diploma. And you need to realize that. I'm speaking now specifically to any young doctor that may be listening to this that is volunteering to go to a war zone. You are not fucking special. Okay? And there is a very real reality that you will be down for the count. You want to, talk to anyone in fucking Ukraine, dude. No one on that AO has a bigger target than a medical provider. They are looking for you. And so the chances of you being down for the count and being wiped out and having to wait for your medics to come take care of you whenever they get back from mission because they think your role 2 is still standing, and that's the only time you're going to get any relief is when they come to bring you patients and find out that you're laying there in a building that used to exist. You're going to hope that they're ready for that, right? And we're not special. Ukraine is what Lisco will look like. It's going to be, you're not even going to see your enemy's face. It's going to be a bunch of explosions, and you as a provider are not just going to be within the blast radius. You will be the target of that blast radius. So now more than ever, it is upon you to train your people around you. The Rangers have the ARFR program and the RFR program. where every person who goes out the door can do life-saving interventions. We're talking about, chest tubes and intubation and all this stuff, but that's not, and surgery and all that. Like, medics save more lives than any surgeon ever can by orders of magnitude, right? And so, we can sit here and debate, should medics be doing X laps and all this stuff? And I say, well, why? That's a stupid argument to have when talking about this. Regardless of my opinion, that's not the argument we should be having. The argument should be having is, what more T-Tri-C training should we be pushing out to all of our soldiers? Because in my opinion, if you're stepping out onto a battlefield, you shouldn't just have a tourniquet on you. You should have a tourniquet on you. You should have an IV start kit. You should know how to fucking give blood. You should know how to start an IV. You should know how to do a finger Thor. You should know the basics of human physiology, because you don't ever want to be in a situation where your buddy's dying and your medic is down for the count and you don't have anything to fucking offer them except being there for them, which is good, but you want more, right? And that's a reality. And that is a very much a reality. And so I'll tell you, there's nothing doctrinally or programs from a big Army standpoint that are set up right now to push this out. But I will tell you, again, talking to the doctors listening or the PAs listening, right? Specifically to them that are going to go on a deployment. What do the customers do every day? And this question is to you. What do the shooters do every day on deployment?
Let's see, we do PT, we eat, we insult each other, and we go to the range.
Yeah. Working out and shooting. Because that's what you do, right? I cannot tell you how many times that I've I've talked with my friends who did conventional deployments, or even I'm guilty of it myself, that as a medical team, as a surgeon, there were days I did not do medical stuff. Lots of days I did not do medical stuff. That's bullshit. You should do something medical every day. The soldiers are out there doing PT and shooting every day to hone their skill. You, as a medical provider in a deployed setting, should be doing something medical every day. Whether it's patient care, hopefully there's not that many patients, but if you don't have patients, then guess what? Take your medics, refresh them on their skills, train them new skills, train them concepts of managing chaos in a mass count, train them to function when you're not around, or to assist you when shit hits the fan, in stuff that you use it with your comfort, right? The medic usually is there and is happy to learn new skills and wants to learn new skills. And it's upon you to mold them and teach them in that scenario how you want, right? And you can set them up for huge success, even as an adjunct to you, or to function when you go down, right? And take the people who are not medical. I can't tell you how many times on my deployments in Afghanistan, we would just pull in Ranger infantry guys and teach them stuff. They get all their first responder training. They know how to put on tourniquets, but let's teach them how to do IVs. Let's teach them how to pack wounds. Let's teach them how to secure C-spine. All this stuff. It's so easy and so important. It's a nothing investment on a morning of a deployment that builds camaraderie with you and the people you're going to take care of, the people who might be taking care of your ass if you get fucking wiped, and it's going to save lives. There's no reason to not do it every day, and so that's something that I want to push out to the young guys that might be deploying. Just there's a lot of this attitude of the latter GWAT of just being in a role 2, doing nothing, sitting there, working out, watching TV, and not even knowing who your soldiers are that you could be taking care of. You don't want to be that fucking guy. You don't. Yeah.
Now, one of the things I reiterate to my medics when we're training, so I tell them way beforehand. It's like the easiest thing I can do to throw a monkey wrench in everything that you think and know is to put two of you together. And so, and what you end up is like two tornadoes of medicine that are whirling around this patient, and just like a bunch of random medical things happen.
Yeah.
And usually they step all over each other. And so, of course, I just let this chaos happen. Eventually the lane is over and we go talk about it. And I asked them, like, of all the things that had happened with this patient, how many of them required an 18 delta or SOIDC or whomever to do this? And usually the list is pretty small. It definitely fits on one hand for certain. And I was like, do you train your non-medical teammates to do the other 90% of the stuff that happened, right? Put tourniquets on, pack wounds, chest seals, do an IV, etc., etc., etc. Because when you have, even if it's the chaos of a casualty, you have a finite amount of decisions that you can make, just period. If I can tell another person, get me access, not, I want you to put an 18 gauge in the left AC and secure it with a PRN adapter and a tegaderm, just give me access in some way.
Yeah.
You know, stop this bleeding, you know, prop this guy up, etc. I offload all those decisions onto somebody else, and that allows me to step back so I can think, which is why I went to, you know, an entire year of medical training, so that I can do this. So, you know, so I've learned all this anatomy and physiology, et cetera, et cetera, et cetera, so that I can think about what is it going to take to get this guy forward, you know, and then you just multiply that when you're dealing with the mass cast, because you have that many more patients. You physically can't do all the things for everybody. So it's incredibly important, and it's almost a cheat code. If you train your guys to be able to do the basics, you ultimately end up doing less, and your patients ultimately get farther forward faster than if it's just you bouncing around.
Yeah. Yeah, exactly. I mean, I can tell you're 100% correct. It's the down and in and the up and out. And the younger guys, I don't want to say younger, the more inexperienced or the newer guys want to be down and in always, because that is the easiest way to gain control. When you're met with this chaos situation, and you get overwhelmed, and you get in your OODA loop is fucking slung out the door like a frisbee, right? And you're like, I don't even know where to start. I'm so overwhelmed. I'm spinning my mental wheels. A lot of people's knee-jerk response is to hyper-fixate on one thing that they can control, because it gives them a sense of positive control and a sense of, I'm able to affect this change here and now, right? And that is and even up to the trauma surgeon level, I can immediately tell who is a new surgeon, a new trauma surgeon, because in a bad trauma, they're going to want to get in and do a procedure. They're like, oh, okay, this guy needs a femoral A-line or a cordis or a chest tube or, you know, a ED thoracotomy, like, and they're like, okay, and they go in, they dive in because they know they can control that, right? And it's like, no, you have chief residents, you have junior residents, you have nurses, you have medics, you have an anesthesia provider, ER doc at the head. All these people are capable. Did you fucking train them beforehand? Oh, you did? Okay. Then rely on them. Allow them to be your hands and ears and eyes, and you stand at the foot and be the brain, right? Like that's what a senior trauma surgeon should be doing, right? As opposed to, oh, you didn't fucking talk to your trauma team at the beginning of the shift, like every time I'm on shift, the first free second I get, I go down to the trauma bay and I see who's on with me that day. Like, fuck, I'm the only person I know that does that. Like, why? It takes 5 fucking seconds, and it's just so valuable to just know, oh, I got Dr. So-and-so on today. He's good at X, Y. Like, you know your team, right? The first chapter in every trauma textbook is leadership and team dynamics. It might be a chapter on like surgical history, but the first 1 or 2 chapters is team dynamics, always. One of the first CPGs in any trauma center is going to be team roles and responsibilities. CPG number 1 for us, or 2 for us. Activation criteria is number 1, right? And so, like, it's like, know your team. Like you said, be the up and out guy and controlling, and have your people doing the down and in. And if you don't trust your people to do the down and in, then that's a failure on you because you have not trained them to your standard. And if they don't know how to do the down and in, then that's also a failure on you because you didn't train them on that, right? And so, yeah, that's a very good point, is like, you need to be the up and out guy in those situations if you're the senior medical person, right?
Absolutely. We're running along on time, but and I know you have an appointment coming up, but are there any other like lessons learned that you'd like to push out there?
Absolutely. Yeah. Yeah, I would yeah, I think that that's great. Yeah. Because there's a lot of stuff that I do want to talk about. I guess this could be like a up next section on the next episode. No, it's no. I did not realize the realities of behavioral trauma, of PTSD. And it comes in many shapes and sizes. Like, and it's so, it can cripple you if not taken seriously. The analogy that I use is that if you break your femur, you know, you can rehab it all day long, every day. You're still going to have pain in your femur, and you'll never really be back to 100%. If you have some mental trauma, and you don't rehab it correctly, you will have bad, habits and bad mechanisms to deal with future trauma and future events. And you will be crippled, and you will be nowhere near the person you used to be. And you may even be a whole new person that's worse, right? Because you've learned to cope with things in an even worse way, like abuse or alcohol or just running from the stimulus, right? If you rehab it correctly, though, you can actually you'll never be the person you were before, but you can be a new person that's actually better in a way. A different person, but a better person, more mature, more prepared, for chaos and terror and horror and failure, and can actually use your lessons to be a teacher to others, and be there for them when they go through the same shit, and be more of a mature leader. Like, hey, I've got some pretty real scars, and I know that, like, this is probably something we should not be doing or should be doing, right? And so, it's, you know, I see that on the back of your wall there, you have "Hope is not a plan." Is that what that says? Yeah, that's that. Yeah, that's a great saying that we learned in the ICU, is hope is not a plan in the ICU. My saying, that is on the back of my, memorial bracelet for Master Sergeant T is, failure is the best educator. And I know we commented on this in this video a lot. You keep saying, you know, like, I will always feel like I failed. But that's okay, because I take it seriously and I look at it every day, and I don't look at it with despair. I did initially, for sure, looked at it with despair and doubt and hopelessness. But now I look at it as, okay, I failed. What can we do moving forward? What did you learn from this? And how are we going to make others not fail, or others do better, or fail to a less degree? The reality of medicine is that we're always going to fail. Let me put it this way. 100% of all doctors in history have failed at their job, because no one's fucking lived forever, right? So, like, everyone has failed, so, and on top of that, you're going to fail to much greater extents. It's just the nature of the game. You're playing with lives, right? You're going to fail. Your failures are going to be hard, and they're going to be cruel, and they're going to be disgusting and painful. You have to look at all of those failures and learn something. You have to. That's why it's called a practice. You're practicing medicine, because no one fucking gets it perfect. And I know that's such a cheesy cliche of a line, but it's a reality, is that, and there are so many people that fail and are quick to blame it on someone else, or say, it is what it is. Couldn't done anything about that. Dude was going to die anyways. He was sick as shit, right? Like, no. Like, don't let the failure cripple you. Don't ignore it. Learn something from it. You fucking have to. You owe it to the next guy. You owe it to the guy that died, or the guy that's injured. Like, if you didn't learn from the gift that he or she gave you, that is a disgrace, right? And so that's my saying is, failure is the best educator, for sure.
Yeah, I absolutely agree. And just recognizing, like, the failure doesn't necessarily define you as, like, this is who you are now and forever. But yeah, absolutely, just learning, taking that step back, and even some of my own things, like, I had to reach out to somebody and just, like, kind of, prostrate myself, like, this is what happened, this is what I did about it, like, go ahead and flame me. And they didn't. They're like, yeah, like, what else would you have done? Yeah. And once I finally got over that hump, then I could actually look back and, like, okay, objectively, was there something I could have done better? Could I have packed better? Could I have triaged better? Could I have attacked the problem in a different way? Not as aggressively, more aggressively. But just kind of getting over that, and I don't even know what it would be called, maybe survivor guilt or provider guilt or whatever it is, just to, like, get to the point where now I can actually turn and face it, and then actually learn and fully overcome what happened.
Yeah.
If that makes any sense. I don't know.
No, it makes perfect sense. Yeah, absolutely does. Yeah.
Okay, perfect. Well, again, Max, this was an amazing talk. I really appreciate you coming on to our little podcast. And there's some great lessons learned in here, and I'm sure it'll be dissected for quite a while.
Awesome. Can't wait. Let me know about the next one. I'm happy.
I sure will.
Yeah, please. I would love to have talk about that if you want, for sure. And thank you for having me on. I know I went a little long-winded. I thank you for putting up with my my long-winded narratives. But it's such an honor to be here and to tell the story and to talk to you. And thank you for listening, and thank you for taking an interest and passing on the message and doing everything you do, because you are helping me not fail and conveying the message to someone who I will never meet. Hopefully, not make the mistakes I did, or learn from this talk and not make new mistakes and save a life. So thank you.
Hey, thank you. That's it for today's podcast. Make sure to go to our website, www.prolongedfieldcare.org. Check out our free downloads and a ton of other helpful information. Grab a bag of our fresh roasted PFC coffee, links in the description below, and stay on the bleeding edge of combat and austere medicine. This is Dennis for the PFC podcast. Out.